Hi, I'm Alicia, speech language pathologist from adultspeechtherapy.co. And in today's video, I'm going to be talking to you about how to decrease hypernasality. So you may have some patients who present with hypernasality. We see this in patients sometimes who have dysarthria, voice disorders. What is hypernasality? So hypernasality is when patients produce non-nasal sounds as nasal sounds. So again, I talked about how that can be presented in voice and dysarthria disorders. So here's an example of it. So for instance, if someone says maybe baby, it may sound like me, maybe, like they're speaking through their nose. A great treatment approach for decreasing hypernasality is ultimately to help your patients become more aware of it. So here are some ways of how to help your patients with this difficulty. So first off, you can have your patient label. So if they listen to their voice, such as if you do a recording with your phone, iPad, or computer, have them listen to their voice and label it as that is nasal. Then as they start to speak and do different tasks, they can pick up on their nasality and label it, oh, I hear I'm being nasal right now, or hypernasal. So again, bringing that awareness to them, you may want to start with an audio recording. You can also then have them read several different words that have nasal versus non-nasal sounds in words and have them listen for the difference. You can use them as well, having a tactile feedback when they're producing these sounds. So again, if you're doing a tactile feedback, you're going to have them feel on the side of their nose, or 2 fingers is fine, and have them listen and feel for the vibration. For instance, if I'm saying nasal sounds such as M or N, ma, na, nice, no, new, I'm feeling the vibration right by my nose. If you have them do non-nasal words such as bo, boo, be, by, they should not be feeling any vibration going through their nose or near the sides of their nose with that tactile feedback. Another way you can have them decrease hypernasality is have them use an open mouth posture. So when they're saying their sounds, they will use an open mouth, having them exaggerate the sounds, and that will produce a more oral sounding voice or oral focus. The last thing you can do, which I have presented a video in our YouTube channel about, is the yawn sigh. So the yawn sigh technique, what it does is it targets lowering the back of the tongue and raising the velum or soft palate of your mouth or the back of the mouth. So this in turn focuses on more of an oral sounding voice. Again, bringing that oral focus, decreasing the nasal sounds. So what you can do is have them sit up straight. You're going to have them do a yawn, then sigh, and when you start to sigh, you will actually have them produce their sounds. So, pa, ba, na, ma. Again, focusing on the production of the words in the oral cavity versus the nasal cavity. You again can have the patients use this yawn sigh technique throughout their day when they're trying to speak. Good luck teaching your patients how to decrease their hypernasality. For everything else, including free PDFs, be sure to check out adultspeechtherapy.co.